Joseph Christiano. He is an author, and also he is got a world of new concepts in stem cell regeneration that I want to bring out to you today. Uh, Joseph, welcome to the show. Thanks for being here.
Michael, thanks for having me. Great to be here.
Give us some background. I looked at your website. What a remarkable change you've gone through, a transformation. And I want to hear more about the 26 disruptive technologies in advanced stem cell activation. Please take it
Yeah.
away.
Well, for my entire life, I've been very physically active, since I was a kid in sports. And then when I went to school, I played in sports, team sports and things like that. But I really fell in love with the barbell, way back in the day. And so I continued on pursuing that, and I became very competitive in bodybuilding and powerlifting and things like that, and ended up really racking up my body. But, as a young guy, you kind of beat yourself down, throw a little dirt on it, and then you move on and forget about it. But over the years, things started accumulating, and I started living with chronic pain, especially in my lower back. And so from there, it got me to doing a lot of research. In other words, as a naturopathic physician, I'm looking to always research in which I can help people, find remedies and natural solutions to what's ailing them and so forth, and myself being my own patient. And so through the years, and I'm rolling up a lot of years quickly here, but I ended up in a walker. Actually, ended up in a walker about 7.5 years ago, and it was really devastating because of the chronic pain had gotten so bad. And so it really got me searching for remedies outside the box, so to speak, outside of conventional medicine, where you can do something naturally that would work with your own genetic materials. And sure enough, I came upon stem cell therapy, PRP therapy, and even stem cell activation. And it's revolutionary. It's changing the way, or I should say, the old norm for doing things with orthopedic medicine, because today you can actually heal your body. Stem cells being used today, you can extract a person's own stem cells, prepare them in a lab, re-inject it, like say in a knee, person has a damaged knee. They get that death sentence where they're told, well, you're bone on bone, and they're living with a lot of pain. And of course, right there at the joint in the capsule of the knee, the cartilage tissue, that protective material is worn away. And so when those bones rub, it's like striking a match, and your knee swells and you got a lot of pain. And the protocol is, well, we'll take a little anti-inflammatory, we'll take some pain meds and see if we can get you through. But month after month, it gets worse. You can't even function. And so sit down with the doctor, and they say, well, listen, we're going to have to do a knee replacement surgery. And it's common, and you go home with this horror story, because you're looking at having a partial amputated leg, putting in a piece of metal, sew you back up and see how you do. Well, now we can actually take your own stem cells, prep them in a lab right there as an outpatient scenario, as I mentioned, and re-inject them into the knee capsule in this case. And two things happen right away. First of all, the pain that the patient is feeling dissipates within up to 24 hours, maybe 36 hours. So now they feel brand new. It feels like the knee is new, but the knee hasn't healed yet. But because of mitosis, these stem cells that have been injected into that knee actually start multiplying day in and day out, week in, week out, and so forth. And over time, they've got billions of stem cells that are healing and attaching to the cells of the remaining cartilage tissue, and over time actually grows back the tissue. So this person had, instead of having an artificial knee for the rest of their life with all these potential fallouts that come with that, saved their knee and has a brand new structure, and it's all done naturally. So to me, it's pretty amazing, absolutely amazing. I refer to disruptive technologies and therapies because it's really replacing the old way of doing things. And we see it now in like orthopedic surgeons and things like that. They're learning how to use stem cells and how to extract them and how to do the procedures, because I think the 21st century patient today is a little looking for options, more options. They're doing the research, and these are very natural remedies, protocols, if you will, to actually get the body to heal itself. So I think it's fabulous.
Now, you have been working in this field for a while, but from what I understand, there is more to the stem cell regeneration process than just pain. I mean, there are other diseases or illnesses that this can affect in a positive way. Bring those out.
For example, degenerative illnesses. You're talking about diabetes. Okay, what I was referring to then, which is the most common, is musculoskeletal issues, joint pain, damage, and things like that. But a person may have MS. A person can have Crohn's disease. A person can have COPD, problem with their lungs, and things like that. And a person can actually go through a very simple process. Again, in the clinic, have a blood extraction. They might do a blood draw, and they'll pull out some of the growth factors. But then they'll do a mini liposuction, and they go to the stomach and they do a mini liposuction. They extract belly fat or adipose tissue, and from there they put it in the lab right there in the clinic, and then they begin to extract the stem cells, maybe 10, 20 million stem cells, and then they prep the syringes, and then what they do is an IV. So by doing an IV, these stem cells now, the person's own stem cells without medication, goes in and through like little Pac-Men, and and they're concentrated and they're becoming the cell of the damaged tissue. So if a person has, we'll say, COPD, person that has terrible lungs from whatever condition or any reason, these stem cells become the cells of the tissue. If it's nerve, they become neurons. If it's bone, they become osteocytes and things like that. So your stem cells are identified, or they don't really have a label. They become cells. And so that's I don't want to say the magic, that's the beauty of it. And so what happens is the tissue that is deteriorated or deteriorating now can be rejuvenated, and that organ, that system goes back to normal function. Pretty powerful stuff.
What about the risks, the downside? Tell me about those.
Well, it's really minimal. It's really minimal. I mean, when you're doing injections or extractions, you're looking at making sure everything's sterile. Infections, you want to watch that, but you're not using any foreign matter. You're not using any medications. There's no rejections that I've heard of yet. And so it's very minimal. There might be a little soreness at the site where you're injected, but that's very minimal. If a person is in a lot of pain, that's nothing. But nobody likes needles. But believe me, I've had stem cell treatment done back in 2008. I went as far as Honduras, Tegucigalpa, Honduras, because at the time the FDA wasn't allowing certain types of treatments here in the United States. So I flew there and had a treatment done. And in a foreign country, a little bit concerned about safety as well as sterility and things like that, but it was absolutely wonderful. And here in the States now, I'm more involved in it because of that, and because I'm a patient of stem cell as an advocate, as you can see. Now it's advanced. It's gotten to the point where now, as a person gets older, particularly 60, 65, 70 and older, your stem cells aren't functioning the way they normally did when you were younger. In other words, your stem cells sit in the body as a reserve team, repair crew. And when there's trauma to the body, if there's disease, if there's illness, they're released and they go to that particular area and they become those cells and heal the body. But over time, you'll see that, we end up with maybe a nagging condition, a chronic condition. It's because the stem cells aren't doing their job any longer. So now we have umbilical cord stem cells. And I'm not talking about embryonic. I'm talking about where the mother, she goes through this huge interview and such where she gives permission to the physician that once the baby's delivered, they clamp off the umbilical cord and they extract the blood and the growth factors and the Wharton jelly and the stem cells. And in that case, they prep it. So now if you have a condition, whether it's musculoskeletal, whether it's joint, back, neck, knee, or so forth, or if it's you require an IV, now you're using this very, very potent form of stem cells without rejection. So it's really advanced. It's really, really come a long way than when they started this back in the early days.
Wow, that's interesting. All right, Joseph, thanks for being a guest on today's show. We can definitely have you back and start drilling down into your book. Let me make sure I got that right. That is Discover 26 Disruptive Technological Advances in Stem Cell Activation, right?
Yes, yes.
Perfect. I'll talk to you real soon. Thanks for joining with us today.
Thank you, Michael. Thank you for having me.
My pleasure. You've been watching CEO Money with Michael Yorba. Don't forget, like us on Facebook, follow us on Twitter, and subscribe to our YouTube channel.